So this video is artificial lash application, and we're going to start the video like when we first arrive at work. So we're actually going to wash our hands upon arriving at work. First thing you want to do is wet your hands and get your liquid hand soap. You're going to get a good coin size between the palms. You're going to wash down to the wrists. You're going to wash the back of the hands down to the wrists. You're going to wash your fingers. You're going to wash the backs of your fingers. You're going to wash your fingertips and nails. You're going to wash your thumbs. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your wrists. And you're going to do all of that hand wash for 20 to 30 seconds. And then you can rinse your hands underneath the water thoroughly, and when they've had that proper rinse, find either a clean towel, disposable paper towels to turn the water off with. Go ahead and dry your hands off. When your hands are good and dry, you're going to get that hand sanitizer, 70% ethyl alcohol, and you're going to do a really good hand sanitizer. And that's before you even start preparing your room. You've got to make sure it's nice and clean and that you have it ready for your clients. So the steps for that are you want to prepare ahead of time before your client even shows up. So what you're going to do is you're going to disinfect your workstation, your bed and equipment using a disinfectant wipe following manufacturer's instructions. You need to dispense products needed for the service. You want to prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup or tray, or remove the product with a disinfected or clean single-use spatula. Close the lid to the product and set the portion cup or tray on the tray. And then you're going to place disposable paper down on the disinfected bed. So I'm going to go ahead and show you my tray that's set up here for the service. I've got my makeup remover and my disposable cup. I've got cotton rounds. I have my implements, which would be tweezers and a small pair of scissors. I've got a set of lashes with my lash glue. I've got some single-use disposable applicators to apply the glue in trash. And then, of course, I've got some disposable mascara wands. They would be single-use trash. Disposable gloves. And I've got some paper towels, tissue, things that I might need that are extra. They're also on my tray here ready for the service. So we're going to take that out of the way because we have to go and meet with our client who's just arrived. And going to say this, but it's just should be obvious. When I meet with my client, I'm going to have clean hands. So if you need to wash your hands again before you meet your client, do so. I'm going to wash before I start performing the service, but just a note there that whenever you greet your client, your hands are already clean. So I'm going to greet my client and escort them to the work area, and I'm going to assess the client's current style. I will determine the client's preferences and assess the client's needs. I'm going to assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice or scabies, to prevent from safely performing the service. I'll assess the client's consultation form for any medications and products used within the last 72 hours. I'll consult on any known allergies. I will consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. I'll assess if the client is prone to cold sores or fever blisters. I'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. I'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from all of those contraindications, we will then be able to perform the service, which my client is. So I am going to now get the client ready before I wash my hands. So for this particular service, the client does not need to disrobe. We would just simply take them to the bed to lay down, and then we'll use something to take the hair back, be it a headband, a hairnet, both, whatever you need so that the hair's out of the way of the eyes. And then we're going to place a drape or cape over them to cover their closed because we don't want any eyelash glue